Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the male-female health survival paradox. Women get sicker, but men die quicker. Defining the paradox, two sides of the same coin. The paradox is defined by two consistent global health observations. Number one, the longevity advantage. Women have a lower mortality rate and a longer lifespan than men, by about 5 years globally. The morbidity burden. Women have a higher prevalence of non-fatal chronic conditions and disability, resulting in a shorter health span. Why women live longer? Biological factor. Females, double X chromosome. Genetic backup system offers cellular redundancy. Estrogen, cardioprotective effect, delays heart disease. Males, lack of X redundancy. Higher testosterone is linked to immune and cardiac costs. Behavioral factor. Females, lower rates of historical substance abuse, smoking, heavy alcohol use. Males, higher rates of risky behavior, dangerous occupations, combat, extreme sports. Healthcare factor. Females, more likely to engage in preventative care and regular checkups. Males, less likely to seek medical care until a condition is severe, leading to late-stage fatal diagnoses. The morbidity burden, why women get sicker. Women disproportionately suffer from diseases that cause chronic pain and disability, but are generally not acute causes of death. Chronic non-lethal conditions, autoimmune diseases, lupus, rheumatoid arthritis, and multiple sclerosis. Musculoskeletal issues, higher rates of severe arthritis, chronic back pain, and debilitating osteoporosis. Mental health, higher reported rates of depression and anxiety, which impact self-reported health and quality of life. The accumulation effect. Living longer simply provides more time for age-related chronic diseases, such as dementia, to develop and accumulate. The health span gap, quantifying the years lived in poor health. The problem is the health span lifespan gap, the number of years spent in poor health. Global data. Women experience a 2.4-year wider gap in lifespan versus health span than men. The proportion is the problem. In the EU, women spend approximately 23% of their total life in poor health, compared to 19% for men. The US context. The United States records one of the widest divides, with Americans living an average of 12.4 years with disability and sickness. The longevity goal, shifting the focus from lifespan to health span. The goal of modern longevity medicine is to compress morbidity, to maximize health. Adjusted life expectancy. We must push the onset of chronic disease and disability closer to the very end of life, ensuring the extra years gained are also healthy years. Solution number one, biomedical and research reforms. Investing in female-specific science. The biggest driver of the morbidity gap is the lack of understanding and delayed diagnosis in female biology. Mandate, sex disaggregated data. Require all clinical trials and research to include both sexes and report results specifically by gender rather than generalizing male data to women. Study hormonal health. Deeply research menopause and the rapid decline in estrogen, which accelerates cardiovascular disease, osteoporosis, and dementia. Advance targeted therapies. Develop longevity drugs, geroprotectors, with protocols specifically tailored to women's metabolic profiles. Solution number two, healthcare and clinical delivery. Improve diagnostic timeliness. Address systematic bias that leads to diagnostic delays in women, e.g., atypical heart attack symptoms. Early detection is critical for chronic conditions. Prioritize function. Shift clinical focus from merely preventing death to preserving muscle strength, bone density, and cognitive function. For example, resistance training and balance work. Integrate psychological care. Given the higher prevalence of depression and anxiety, integrate mental health and psychological flexibility training into primary care. Solution number 3, socio-behavioral changes. Address socio-economic barriers. Policy changes are needed to support economic equality and caregiver relief, as women often face lower lifetime earnings and extensive unpaid caregiving roles. Promote digital health literacy. Counter the vast amount of misinformation regarding hormones, nutrition, and supplements targeted at women. So, in conclusion, by treating women's health as a vital area of longevity research and economic investment, the health span gap can be significantly narrowed. Well, thanks for listening to this podcast. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you.